So, have you ever thought about what really happens when you get a tooth pulled out? It's
Not in
actually more
detail.
involved than we might think.
Really?
Yeah.
I always figured it was just a simple procedure.
Well, it's not just about yanking a tooth.
Right.
There are so many reasons why a tooth might need to be removed.
Like cavities and accidents, I assume?
Exactly. But also things like baby teeth that don't fall out on time or even making room for braces.
Oh, interesting. Wait. So baby teeth can actually prevent permanent teeth from coming in?
Yeah, that's right. If they overstay their welcome, they can block the new teeth.
Wow, I had no idea. And braces sometimes require extractions too?
Yep, to make space to align the other teeth properly.
Makes sense. What about wisdom teeth? Those are a whole other story, right?
Oh yeah, wisdom teeth are like the troublemakers of the mouth.
Ha ha!
They often need to come out because they can cause pain or block other teeth.
I remember when mine came in, it was not fun.
I bet. And did you know that even cancer treatments can lead to tooth extractions?
Really? No way, how does that happen?
Well, some cancer drugs weaken the immune system, making teeth more susceptible to infections. So
Oh, I see.
extractions might be necessary.
That's intense. So what's the process like before getting a tooth pulled?
First, the dentist will take an x-ray to plan the extraction.
Right.
And it's crucial to give them your full medical history.
Including any medications you're taking?
Exactly, everything from prescriptions to vitamins.
Got it. Is there anything special you need to do before the procedure?
It depends, but sometimes dentists prescribe antibiotics beforehand to prevent infection.
Okay. Even if you're not sick?
Yeah, it's preventative, but always follow your dentist's specific instructions.
Makes sense. So how is the actual extraction done?
There are two main types, simple extraction and surgical extraction.
Mm-hmm.
Simple ones are straightforward, but surgical ones are more complex.
Surgical sounds scary, is it?
It can be more involved.
Yeah.
They might need to cut into the gum or even remove bone around the tooth.
Oof, that's intense. Do they use anesthesia?
Absolutely. Local anesthesia at the very least, sometimes even general anesthesia depending on the case.
That's reassuring. So you don't feel anything during the procedure?
Just some pressure but no pain. If
Good
there's
to
any
know.
discomfort, you just tell the dentist.
What about after the tooth is out? What's recovery like?
You'll get specific post-op instructions, but key things are no smoking, no using straws, and no spitting.
Right. No smoking? Why's that?
Smoking can disrupt the healing process and increase the risk of infection.
Ah, makes sense. Any tips for managing pain afterwards?
Ice packs are great for reducing swelling.
Okay.
And some people swear by eating ice cream. Just check with your dentist first.
Haha, any excuse to eat ice cream?
Exactly. But seriously, following the dentist's instructions is crucial.
Definitely. Speaking of grandma's advice, does rinsing with salt water help?
It can, but again, check with your dentist before doing it. It
Will
helps
do.
keep the area clean.
How long does healing usually take?
Initial healing is about 1 to 2 weeks.
That's not too bad. And stitches, do they need to be removed?
Often they're the dissolvable kind, so they disappear on their own.
Convenient. What happens if someone doesn't follow the aftercare instructions?
They risk complications like infections, which can lead to more time and money spent on treatments.
Yikes. So bottom line, follow the dentist's orders.
Exactly. And don't forget, maintaining good oral hygiene helps prevent extractions in the first place.
Absolutely. Thanks for all this info.
No
It's been
problem.
really enlightening.
Glad to share. And remember, always brush and floss.
Will do.